Hi, my name is Kathleen Melly, and I'm an occupational therapy student at Huntington University. I've been working on my doctoral capstone project since January with Will County Health Department. I've been in touch with many of you over the last few weeks, kind of sharing with you about my project, getting information from you. You've all been incredibly helpful. So today I'm going to present a little bit on what I found, a little description of my program, and give you guys the opportunity to provide me with feedback. Mainly the purpose is to gain feedback from you. This is a sustainability meeting. It is one of my deliverables for my capstone to ensure that there is carryover with my program in some capacity after I leave. I'm trying to make this as little extra work for anybody, and I really need the feedback, so there are plenty of opportunities for you to provide feedback. For those of you who are not in the live webinar, you can use the link on the side there, the QR code, or text me your email address, and I will share the survey with you. I also welcome feedback through phone call, through email, whatever. It doesn't have to be the survey. So let's get going here. I'm going to describe the overall description of my project, the creation of the program manual, which was based on previous literature and 2 studies I conducted, a description of the program I'm proposing, and a discussion on feedback and sustainability. The overall purpose of my project was to look at the social distancing guidelines and the effect on older adult mental health, particularly in the relation to social isolation and loneliness. And overall, my deliverable was to create a program manual for the Will County Health Department and their community partners. I developed that program manual based on survey data and interview data, which resulted in a mixed method study that provided a needs assessment, and eventually, based on the results and based on my interviews with many of you and the staff at the Will County Health Department, I developed the program manual as a tool and created a program that was training, that will train professionals on utilizing the manual. So it's a little confusing. So I have the manual as a deliverable, and that actual program is to train people on the manual. This was the process I followed for the program manual. So kind of just exploring through pre-planning and the needs assessment, which I primarily did through conducting 2 studies, planning the program, and then everything else after that is more of a plan, an implementation plan, evaluation plan, sustainability, and dissemination. That part is more the planning, and why I'm presenting to you today in terms of getting your feedback for my plans with implementation and evaluation, and finding the best possible way to do that makes the program beneficial for you. Just some background information. While social isolation and sheltering in place are crucial to us controlling the pandemic, keeping safe, preventing infection, it does cause a little bit of social isolation and loneliness, which are detrimental to physical health and mental health and overall quality of life. So we're kind of caught in this catch-22 where we need to shelter in place, we need to socially isolate from others to protect our health and others' health, but social isolation and loneliness is also bad for our health. On a physical level, we are, as humans, we need contact with other humans, whether that's eye contact or physical contact, verbal contact. It's critical to our survival. And when we don't get that, it does have serious physical health outcomes, or it's associated with those outcomes: higher blood pressure, hospitalization, heart disease, obesity, immunodeficiency, vitamin D deficiency, falls, decreased life expectancy, pulmonary reserves, and independence with activities of daily living. The mental health side of it is a little more obvious, but also a major concern, as when we don't When we're lacking that social connection with others, we have a lost sense of direction, purpose, or meaning. This is especially important for older adults when we look at developmental theories of aging and the increased need to focus on legacy, to focus on our impact on others, our purpose. So social isolation could really interfere with even just that developmental stage that older adults are in. Also, isolation is related to several mental health problems. These mental health problems are also incredibly detrimental to function and can become really a pandemic in and of itself when we look at the substance use difficulties in the opioid epidemic, depression, anxiety, and all the things associated with that, attachment disorder. So the physical and mental health implications are related to each other and both very relevant to social participation. In terms of Will County specifically, we see that older adults are a very crucial piece of our population, and B, a lot of the things that they report having difficulty with are related to social participation. So when we look at substance use and transportation, anxiety and depression, those are all things related to social interaction, social connection in one way or another. There are some strengths. 65% report that they get information from the internet, and 93% use a smart device. That stereotype that older adults are not technologically savvy is not necessarily true here in Will County. But overall, when they're reporting things as a large problem, violence, alcohol, mental health, suicide, all these things that they see as large problems are social in nature. So as older adults 55 and older are 24% of our population, it's clear that we need to have a social approach to care. So my project did focus on those 65 and over just for clarification, but these stats were 55 plus. So the percentage for 65 plus might be a little smaller or different, but it's good to keep in mind because those people who are 55 plus will become 65 plus. And that the population is aging, so it's becoming an ever larger issue. More background information for those of you who are not familiar with occupational therapy. I'm an occupational therapy student. Occupation is any meaningful activity. That can be a basic meaningful activity such as feeding, sleeping, getting dressed, going to the bathroom, hygiene, or it can be a bit more higher order meaning in terms of social participation, leisure, work, education, any activity that is found to be meaningful for you, that is occupation. And OT practitioners address occupation through modifying the environment or providing caregiver support, optimizing access, training on coping strategies, overall, and also developing skills as well. Overall, OTs are focused not so much on ability, but on activity and meaning. And if we can find a different way for you to participate in something that's still meaningful, that's what we go to. And that plays a huge role in social participation and even public health, really. So now I'm going to go over the 2 surveys that I did. The first study was a survey. It was used to create a more general needs assessment. And the second study was qualitative one-on-one interviews, and that was to provide a more specific needs assessment related directly to Will County and surrounding areas. This survey was with 230 older adults with a mean age of 72. They were community dwelling and living in Indiana, Illinois, so much broader picture. We looked at demographic data, changes in experiences in relation to COVID, and quality of life scores. So we analyzed for differences in quality of life scores based on demographic data and analyzed for significant changes and reported before and after COVID-19. And so the results from that helped us to develop the basis for the semi-structured interviews where we talked with 5 older adults, 2 were from Will County, 3 were from Cook County, and we discussed pandemic experiences, quality of life factors, behavioral health, social participation, and program design input. Quickly to go through these results, and this is something that the program manual goes way more in depth to, but just to give you an idea of kind of where the recommendations in the program manual come from. Most participants agreed that they had a lower overall quality of life, increased depression, and increased anxiety, but participants did not recognize lower overall mental health despite that. So that kind of keys us into the need for education and shows a little bit of the stigma older adults might have with mental health. They might see mental health as something that crazy people have, and not just depression, anxiety, and those things. Obviously, COVID causes significant change in number of interactions and activities. People felt decreased social support and had increased reliance on others. This increased reliance is kind of a double-edged sword, because on one hand, increased reliance means more social support, but people reported less social support. On the other hand, increased reliance also means a decrease in function and independence. So kind of a complex result there. There's also a need for effective outreach. So we saw lower quality of life scores in actually the older adults of 65 to 75, people who lived alone, people who received social support, and people who reported higher frequencies of self-isolation during COVID. All of these people individually showed lower quality of life scores compared to the others. And lastly, the recognition of performance skills, with younger older adults scoring worse on quality of life skills. That indicates that older adults might have some skills that we overlook, and there is some research to back that up too. So these went into those 4 categories pretty much there, which serve as the basis for the interviews. The interviews also had some really interesting results. Pretty much participants' values and interests were inherently social. Only one responded yes to feeling lonely or isolated, which I think goes back to that stigma with mental health and an unwillingness to maybe share what they're really feeling. But every participant did express longing for participation with family and friends and getting back to how they did that before. It seemed to be like physical closeness was a huge value to people. While virtual was good and social distancing on the porch was great, they missed hugs, they missed the spontaneous interaction with people in the grocery store, they missed the feeling of being in a large group of people at dinner. So that physical experience was very important to people. And changes in relationships and routines were also fairly difficult for all participants. As for activity, there was a decrease in all activity. While some found that to be frustrating and disheartening, some also found it to be a relief, which gets at the heart of sometimes this lack of participation results in a decreased motivation and interest, which decreases our participation even more. Previous research shows that people who are socially isolated tend to view social experiences as negative, and they avoid social experiences, and so that becomes a cycle of social isolation. And the participation activity is similar in that sense. It seems like most people were able to modify certain activities, such as talking with grandkids over Zoom instead of in person, but there was also a lot of just complete loss of experiences in terms of retirement plans, canceled vacation, leisure activities, and family rituals. Some things just became completely canceled, and that was really hard. Opportunities for service was something interesting that was not revealed in the survey. 3 out of the 5 interviewees or interview participants all expressed frustration with the socio-political climate. Many felt disillusioned by their friends' behavior and saddened. Others also felt frustrated and disappointment with the community at large, and disappointment with the younger generation and leadership and those things. And this related directly to function, as many people, some someone mentioned, oh, I'd rather just watch a movie than go on Facebook now. I just don't want to deal with it. Someone else said they wouldn't want to participate in online activities because there's just too much conflict. So this frustration with society at large and the community is an area that we can really address with older adults, and older adults do care about the community and want to, especially where they are developmentally, they want to make a difference. They want to serve. And so those parts of the interviews were really interesting, and I think something we forget that does affect us during the pandemic. We have a crazy socio-political climate right now, regardless of the side of the spectrum you're on. Next, strategy training for meaningful activity. People are pretty good about their coping skills, but not all the time, and they still had some difficulties. There was mental exhaustion, loss of sense of freedom and opportunity, and anxiety over contracting COVID-19, and these are all things that are going to be very dynamic, and extra strategy training never hurts. Okay, so based on those results, while there were many opportunities for different programming ideas, I went with training community partners and professionals on the needs of the older adult population and training people on using a program manual to optimize how much they help older adults. It just seemed the most attainable program for where I was at in my project, but I will recommend other program ideas later in the PowerPoint. So you can see those goals there, and they're related to Will County goals and Will County mission. So kind of just educating on general needs, educating on evidence-based interventions, and providing recommendations and guidelines for people creating or evaluating programs, and advocating for occupational therapy when serving the older adult population. So the goal of the program is to involve health professionals, community partners, or individuals interested in developing programs, providing treatments, or just anyone who serves older adults. They will be provided the program manual and then be trained on using that manual through a series of 5 educational videos that break down the manual. And then in order to have access and effectively operationalize the manual, using the manual and completing the series is necessary. Also, following the series, they will have the option to sign up for an online LinkedIn group for networking opportunities and community collaboration. So just to get that piece that this is not where we end. There is, once we have the education, there's somewhere we need to go with that. So here's kind of that action plan laid out. I will be using voice threads for the videos. The program manual will be available as a simple booklet, which is a website. The sustainability meeting is super crucial to all of this, as you will provide input and feedback that directs where this goes. And just all the completed papers and PowerPoint presentations I made. Overall, the goals and the impact of this is to provide training in order to increase awareness of the older adult population, create a network and a community and interprofessional collaboration to promote behavioral health within the community, and enhance the understanding of the community while exploring implications for future research. So overall expansion of services and opportunities for older adults. Here is just more specific. I pretty much talked about everything here except the marketing through the health department, community partners, universities. I think this is where I could use some of your feedback in terms of what's the best way to share this program. What's a way where this program is most useful? Is it for people working with older adult clients? Is it for students before they start? There's a lot of different areas. Is it for prior to a collaborative meeting about an older adult program, us reading this, right? And then in the LinkedIn group, there will also be opportunities for program evaluation with a SurveyMonkey for feedback and status updates and group member conversation. And hopefully something arises out of that network as well. The intervention plan, these are 5 parts that I will go into more detail on the next slide. So first is just an introduction based on previous literature, looking at occupational therapy, looking at theories of aging. Then the next two parts are the going really in depth into the two studies we conducted. So the quantitative portion and then the qualitative portion, going into study purpose, procedure, results, discussing those results. And then the next part, which will be incredibly important for people who are planning on changing a program or creating a new program. This will kind of mix all of the previous evidence, the mixed method study, and the results of that, to have goals and action plans, recommendations for intervention planning, design, and implementation, and just develop a foundational understanding of evaluation planning and sustainability planning. And then the last part is more of a conclusion, giving next steps for the LinkedIn group, and also kind of talking about Will County and understanding the current resource market analysis and other alternatives for programs. This is an area I'd like to expand more and have community partners and guest speakers. The voice thread, you can upload any type of content to it, so I think this would be a good place to have to be more dynamic and offer up changes and updates and things. Overall, my goal with implementation was to ensure that I wasn't making extra work for anybody else. That was my main problem. There were so many options for programs, but I didn't want to come in here and come up with this program idea and have it be a lot of work, have it be a lot of use of resources and those things. So the goal of my implementation plan was just to provide the foundation for looking at the older adult community a bit more in depth. And so again, this is another place where I could use your input. On one hand, the program could just be, you give this to a new employee before they start working with clients on the work, or you give to students before they start doing assessments of older adults. Or it could be a bit more broad in that the results of this and the training for this creates a team that can begin an older adult program at the health department, right? So there's a wide range of things, but for now, the goal is to just have that online access to the video series, advertise that to the universities and community organizations and just professionals in the area, and kind of let it run from there through the LinkedIn group and sharing of the videos. The budget's zero for now, so I'm trying to make it very accessible to implement. But again, that accessibility comes with the caveat that hopefully it's a foundation for something bigger. So your feedback is helpful in this area. Evaluating this, which this is kind of where some staffing comes in besides maybe me. Periodic review of the feedback survey, kind of keeping it with the LinkedIn group, a 6-month check-in, and maybe even a follow-up study would be a really great next step. Here are some recommendations I have for funding. The community capacity, I think, is really important. I love to get the MAP collaborative in on this, kind of work directly with community partners, get a formal use of the program going, and maybe having guest speakers or having a conference or a meeting, and even involving students in the area. We have so many universities. This is a good way to get students involved. Some supportive relationships, obviously senior services, but also I spoke a lot with Catholic Charities who were very willing to collaborate with this, and the participants themselves are huge in this, in that they are direct stakeholders with the population. So participants themselves, developing that relationship between them and with them, can really make this program sustainable and help it to grow just naturally. Here is my resource analysis for the health department, which is another area I could use your input in. And this is kind of where future program recommendations come in. Using our resources with the MAP Collaborative, the interns, even the behavioral health living room is kind of a cool out of the box area that could become a resource. I bolded the areas that I think are the gaps between what the community is doing and what the health department is doing. This is what's missing. We're missing outreach to individuals. Like I said, that social isolation cycle. People who are socially isolated are not going to be out in the community. They're not going to have opportunities to be referred. So we need a systemic way to identify these individuals and refer them, and really find ways to address that social isolation. Additionally, the transportation limitations and volunteer limitations, these are always a gap, but especially with social participation in the older adult population, these are a bit more difficult to navigate. It might not be as easy as a bus or an Uber, right? Or as easy as just getting another older adult to be a mentor. Some of the results of the interviews were that adults were not as willing to participate in novel activities. Adults weren't really willing to be mentors to brand new people especially during COVID. We just want familiarity. We just need stability. We don't want a new thing. So that creates a limitation with volunteers. But again, going back to that service standpoint, if we can frame this as an area of service, it's rather than an area where we can treat or help older adults. I think that can help us solve that volunteer limitation as well. And some potential partnerships that were not directly available in community partners that kind of assisted in the project. Billy Liemacher Bicentennial Park is a great space. Same with Cafe de Casa. These are familiar spaces, spaces that can where there is an activity going on, spaces that are familiar and you have a purpose that could really be useful with the program. And they're also accessible. They're in pretty centralized areas. Catholic Cherries, their senior companion program, they were very excited about my project and wanted to collaborate. And also the senior services memory cafes. This could be a good, maybe not as a memory cafe, but a friendship cafe or a social cafe, making that connection with other programs that are existing and kind of expanding them to the needs we're trying to address. Also, gaining an occupational therapy consultant or service coordinator, OT, has a huge role in this, and there's a few consultants in the area that might be interested in a public health approach. So now it's time for the feedback portion. You can go to the survey here or email me or text your email address for me to email you, or you can call that number. Overall, I'm looking on how can I make this program better to serve you and to serve your needs. What are the major barriers? What are ways that I didn't mention that might be good supportive resources that I didn't think of? And are there areas that I didn't get correct or could have been better further explored? Really, the more honest feedback I could get, the better. That's the purpose of my project, is to really make a difference in the older adult community. And you all can really help me do that by giving me very specific and concrete feedback that will really create a program that is beneficial. Here are some special acknowledgements. I'm so grateful during COVID, the amount of people who just took that extra time and effort to support me and support the older adult community too. So that's all I have. Thank you so much for attending the presentation or just listening. Thank you.